The National Press Club debate on governmental healthcare policy and congressional oversight of medical institutions had been structured as what event organizers characterized as unique opportunity to examine healthcare regulation through dialogue between Dr. Ben Carson, representing conservative perspective, emphasizing medical professional expertise and market-based solutions over governmental intervention, and Representative Jasmine Crockett, defending robust congressional oversight of healthcare industry, including pharmaceutical companies and medical institutions whose practices affected millions of Americans in ways that market forces alone couldn't adequately regulate without governmental accountability mechanisms ensuring patient welfare rather than profit maximization. Ben Carson sat at the National Press Club podium as a retired neurosurgeon whose pioneering work separating conjoined twins had made him a legendary medical figure, whose best-selling books and presidential campaign had established him as prominent conservative voice on healthcare policy, whose service as Trump administration HUD secretary had given him governmental executive experience, and whose reputation combined brilliant surgical career with conservative philosophy, arguing that medical decisions should be made by doctors and patients rather than by governmental bureaucrats whose regulatory frameworks reflected political considerations rather than medical expertise that decades of surgical practice had given him authority to invoke when discussing healthcare questions. Jasmine Crockett had accepted invitation to debate Carson at National Press Club despite knowing that his medical credentials would create rhetorical environment where questioning healthcare industry practices could be framed as disrespecting medical expertise or as reflecting progressive politicians' lack of understanding about medical realities that only practicing physicians whose careers had been spent treating actual patients rather than passing legislation could genuinely comprehend through direct clinical experience. The debate had been proceeding through opening statements and initial exchanges about healthcare regulation when Ben Carson had begun building toward what was clearly his prepared argument, leveraging his medical credentials to suggest that congressional oversight of healthcare industry reflected fundamental misunderstanding of how medical practice worked and why physician judgment needed protection from governmental interference that politicians without medical training couldn't appreciate despite their good intentions about protecting patients. Then Ben Carson had launched what he clearly believed would be definitive argument, a systematic presentation about how congressional investigations of pharmaceutical companies and medical institutions undermined medical innovation and physician autonomy through regulatory frameworks that treated medical decisions as if they were political questions, subject to legislative oversight rather than recognizing that medical expertise required freedom from governmental interference, that non-physicians whose understanding of healthcare came from policy debates rather than from clinical practice fundamentally couldn't evaluate appropriately. His argument delivered with a combination of medical authority and gentle condescension, suggesting that, while he respected Crockett's advocacy intentions, her lack of medical background meant she couldn't fully appreciate why healthcare required different regulatory approach than other industries. Given that medical decisions involved life and death judgments requiring expertise that regulatory oversight might constrain in ways that ultimately harmed patients, despite oversight advocates' beliefs that governmental accountability would protect them. What Ben Carson had catastrophically miscalculated was that Crockett would respond not with defensive arguments about congressional authority or with general principles about healthcare accountability, but rather with one fact so devastating in its exposure of how Carson himself had violated the very medical expertise principles he was invoking, a documented incident from his HUD tenure, where he had spent $31,000 of taxpayer money on dining room furniture for his office, despite legal spending limits and despite his agency's mission serving low-income Americans, proving that his appeals to principled expertise over governmental accountability rang hollow when his own record showed he couldn't be trusted to follow basic spending rules without oversight. That her one fact would end his entire argument by proving through his own documented misconduct that the expertise versus framework he was deploying was hypocritical. From someone whose governmental service had demonstrated exactly why oversight was necessary, regardless of how distinguished one's professional credentials might be an unrelated field. If you want to see what happens when legendary neurosurgeon builds healthcare argument on medical expertise trumping governmental accountability and congressional member responds with one fact about his own ethics violation proving he couldn't follow basic rules, ending his entire argument by demonstrating that professional expertise doesn't exempt anyone from oversight. Subscribe to this channel immediately, because we are going to examine every element of how Crockett's one fact ended Carson's argument and why this moment became legendary for demonstrating that credentials-based arguments against oversight can be devastatingly destroyed through single fact proving the person invoking expertise has record, requiring the very accountability they're arguing against. Carson's expertise-based argument had come during the debate's main healthcare regulation segment. He had been building his case about medical autonomy and professional judgment with evident conviction about his medical authority. Carson had begun. Representative Crockett, I want to address your advocacy for aggressive congressional oversight of healthcare industry, and I'm going to speak from my perspective as someone who spent decades as practicing neurosurgeon, because I think that clinical experience gives me insights that are important for this debate. The National Press Club audience had focused intently on Carson, his medical credentials commanding respect. Carson had continued. When you talk about congressional investigations of pharmaceutical companies, of medical institutions, of physician practices, you're talking about governmental interference in medical decisions. And with all respect, you're not a physician. You haven't spent years studying medicine, treating patients, making life and death decisions based on medical judgment. I've been in operating rooms where split-second decisions determine whether patients live or die. I've treated thousands of patients whose outcomes depended on my medical expertise, not on governmental regulations or congressional oversight. He had delivered what he clearly believed was definitive argument. And that experience has taught me something crucial. Medical decisions should be made by medical professionals, not by politicians. Congressional oversight of healthcare treats medical questions as if they're political issues subject to legislative investigation. But medicine isn't politics. It requires expertise that governmental interference can undermine. Pharmaceutical innovation, medical device development, physician treatment decisions, these require freedom for medical professionals to exercise judgment based on medical science rather than having to satisfy congressional investigators who lack medical training to evaluate whether decisions are appropriate, he had concluded. So, Representative Crockett, I respect your advocacy, but I'm suggesting that healthcare requires different approach than other industries, because medical expertise is fundamental. Physicians should have autonomy to practice medicine without excessive governmental oversight from those who haven't had the clinical experience to understand how medical decisions are properly made. The argument had been comprehensive, delivered with Carson's characteristic gentle but firm tone, clearly designed to position medical expertise as superior to governmental accountability in healthcare contexts. But what happened next would end Carson's entire argument with devastating efficiency. Crockett had remained calm, had paused for just a moment, then had delivered one fact that would prove his expertise versus accountability framework was hypocritical. Crockett had responded, Dr. Carson, you just built entire argument on medical expertise requiring freedom from governmental oversight because physicians like you understand things that politicians like me don't. You suggested that your decades of surgical experience mean you can be trusted to make judgments without governmental interference. She had continued with devastating precision. So let me respond with one fact about your own record in government, because I think it directly addresses whether expertise in one area means someone can be trusted without oversight in other areas. The National Press Club audience had become intensely focused, clearly recognizing that Crockett was about to deliver a significant challenge. Crockett had delivered the one fact in February 2018. When you were Secretary of Housing and Urban Development, a position serving low-income Americans, you spent $31,000 of taxpayer money on a dining room set for your office. This violated the legal spending limit of $5,000 for office redecorating. When this was discovered through oversight, your wife claimed she had selected the furniture, and you eventually canceled the order and said you would use the old furniture. She had paused to let that sink in. Dr. Carson, You're a brilliant neurosurgeon. Your medical expertise is unquestionable. But when you were in government position, requiring you to follow spending rules, you spent $31,000 on dining room furniture. Despite $5,000 legal limit 6 times the allowed amount to redecorate office while running agencies supposed to help poor people afford housing. That violation was only discovered and corrected because of governmental oversight. The very oversight you're now arguing undermines expertise and should be minimized. The National Press Club debate hall sat in stunned recognition that Carson's entire expertise-based argument had been ended through one fact, proving he couldn't follow basic governmental rules despite his professional credentials. Crockett had delivered her conclusion. So, Dr. Carson, your argument is that medical expertise means physicians should have freedom from congressional oversight. But your own record proves that expertise in one area, even brilliant expertise, like your surgical career, doesn't mean someone can be trusted without oversight in other contexts. You violated spending rules as HUD secretary. You spent taxpayer money inappropriately, despite legal limits, and you only stopped when oversight caught you. That's not me questioning your medical expertise. That's me proving through your own record that everyone, including brilliant neurosurgeons, needs governmental accountability. Because expertise doesn't prevent misconduct or poor judgment in areas outside that expertise. Your one fact about your HUD spending violation ends your whole argument about expertise trumping oversight, because you're living proof that distinguished professionals still need accountability, regardless of how impressive their credentials are in their professional field. After devastating silence, Ben Carson had attempted to respond. That furniture incident was my wife was trying to help, and when we realized there was an issue, we corrected it. But Crockett had immediately replied, Dr. Carson, you corrected it after oversight caught it. That's exactly my point. Without oversight, you would have spent $31,000 illegally on dining furniture while running agencies serving low-income housing. Oversight worked. It prevented taxpayer money from being wasted inappropriately. That proves oversight is necessary regardless of professional credentials. Your medical expertise didn't prevent you from violating spending rules. Your governmental experience didn't prevent it. Only oversight prevented it by catching and correcting the violation. The remainder of the National Press Club debate proceeded, with Carson visibly unable to recover his expertise-based argument after Crockett's one fact had proven that his own conduct had required exactly the kind of oversight he was arguing against. The immediate aftermath focused on how efficiently Crockett had ended Carson's argument. The $31,000 dining set incident had been widely reported during his HUD tenure, but its deployment in this context proving that medical expertise didn't exempt him from needing governmental oversight was devastatingly effective. Political commentators noted that Carson's attempt to build healthcare argument on expertise versus accountability had walked into perfect trap when his own governmental record included ethics violation requiring oversight to correct ethics experts, confirmed that the dining set purchase had violated federal spending limits and that Carson had only canceled it after the violation was exposed through oversight mechanisms, proving Crockett's point about oversight's necessity. For a National Press Club audience, having Carson's credentials-based argument ended through single fact about his own ethics. Violation was compelling demonstration of why oversight applies regardless of professional accomplishments. For Ben Carson, personally, having his expertise-based argument destroyed through reference to his HUD spending violation was an embarrassing reminder that his governmental service had included exactly the kind of conduct that oversight was designed to prevent. For Crockett, ending Carson's argument through one fact demonstrated that sometimes most effective responses are the briefest, ones that prove through attacker's own record that their argument is hypocritical. In subsequent interviews, Crockett explained that when Carson began building argument about medical expertise not needing oversight, she had immediately thought of his dining set scandal as perfect example, proving that expertise doesn't prevent misconduct requiring accountability. She emphasized that she respected Carson's medical accomplishments, but that his HUD violation proved the point that everyone needs oversight regardless of their professional credentials, which was exactly what his argument had tried to deny. So if this examination of how credentials-based argument against oversight can be ended through one fact proving the person making argument violated rules, Requiring oversight has shown you that professional expertise doesn't exempt anyone from accountability, and that sometimes single fact proving hypocrisy destroys entire arguments. Subscribe to this channel for a continued analysis of moments when preparation enables devastating efficiency. The National Press Club debate, where Ben Carson debated Jasmine Crockett and her one fact, ended. His whole argument was more than satisfying. Exchange It was demonstration that building arguments on professional expertise, trumping governmental accountability, creates perfect vulnerability when the person invoking expertise has record including violations that only oversight prevented from continuing. That sometimes the most devastating responses require only one fact proving through opponent's own conduct that their argument is hypocritical. And that credentials, however impressive in one domain, don't exempt anyone from needing oversight in governmental contexts, because expertise in medicine or any field doesn't prevent ethics, violations, poor judgment, or misconduct that accountability mechanisms exist to identify and correct, regardless of how distinguished the professional accomplishments of those being overseen might be.